Our son Jamie loved big adventures. But with big adventures come the risk of some big injuries, and Jamie certainly had his share. And for each injury came a prescription for opioids to help manage his pain.
After college, Jamie started a new life near Aspen, Colorado. He had a new girlfriend, a new dog, and a decent job. But when the girlfriend didn't work out and his close friends remained a few hours away in Boulder, we believe his depression and isolation led him to self-medicating. Not surprisingly, opioids became his medicine of choice.
In July of 2019, I woke up at 3 a.m. and heard a strange sound that I came to identify as someone who was struggling to breathe. That's when I found Jamie unconscious in his bed.
He received top-notch medical care to deal with the physical damage from his heroin overdose. But we were worried about his mental condition, and we asked for a psychiatrist to evaluate him. The psychiatrist assured us that Jamie had just made a bad mistake, and she told us that this would never happen again.
I was stunned. For Jamie to order heroin online, purchased with Bitcoin, delivered to our mailbox, and administered through his nasal cavity, this was not just a bad mistake.
But the damage was done, and we never received a referral to any recovery specialist because in the psychiatrist's opinion, it was just a bad mistake. The psychiatrist prescribed antidepressants for Jamie, and no one from the hospital ever followed up with him again.
In August of 2020, Jamie broke his collarbone in a car accident. Despite a history of heroin overdose and the likely presence of drugs in the system, the emergency department prescribed him opioids to help manage his pain. I arrived at Jamie's house one day after the accident, and by then he'd already used up his 5-day supply of opiates.
Soon after, Jamie began experiencing strange sleep episodes, and we suspected that drugs were involved. We finally convinced him to go to the emergency department. When Jamie refused the staff's request that he get a drug test, we pleaded with the nurse to help us find a way to get Jamie some kind of help. She told us that nothing could be done unless he wanted to make a change. Once again, we were never provided with any referrals for recovery resources.
On December 29th, 2020, Jamie died alone from a heroin and fentanyl overdose.
Jamie's interactions with hospital emergency care were key moments that could have made a difference. Here are some of the things that we've learned.
An overdose is a medical crisis that isn't just about the immediate physical damage sustained by the patient. An overdose should never be treated as a bad mistake.
We've learned there's a lot of shame and stigma. Please help us break the barriers of shame and stigma that people experience from addiction and overdose.
Put the patient and the family and friends of the patient suffering from a substance use disorder in touch with recovery specialists who can help them to help the patient.
Ask about prior opioid experience before prescribing.
Follow evidence-based best practices for opioid use disorder care, including medication-assisted treatment when the patient has experienced an overdose.
Finally, follow up with your patients. You are the best immediate resource for an overdose survivor. Make the most of it.